you would do it, or if you want to use them for an experiment, that's when you would do it, or if you want to do a gram stain, that's when you would do it. So when you do a gram stain, you want to get your cells while they're young and healthy. If I'm trying to identify Crystal, you know, am I going to wait till she's 99 years old and then try to figure out who she is? She's going to be kind of hard to recognize. So maybe I want to check it out while she's a little younger. When you're old, you don't look quite the same. You ever notice that old people look pretty much the same? You know? It's harder to tell them apart, so it's better if you do it when they're young. She's like, that is so true. You must work in a nursing home. Oh my gosh. And anyway, I lost my train of thought there. Okay. Also, in that log phase, everybody's actively dividing, actively dividing, actively dividing. So if you want to get them with penicillin or bacitracin, which is going to interfere with peptidoglycan for the transverse plate, now's the time to give it to them. So the best you can do with bacitracin and penicillin, which target peptidoglycan synthesis, those inhibitors of peptidoglycan synthesis or inhibitors of cell wall synthesis drugs, that's when you want to give them, when they're actively dividing. Because you don't want them to actively divide successfully, you want to stop that from happening, and that's when it's the best time to get them. So that might not come up to your third test, but thought I'd throw it in there now. Okay, then you've reached the carrying capacity of your environment, the agar, the broth, the pumpkin pie in your refrigerator, whatever it is, the patient can't support any more bacteria, the population levels off in the stationary phase, no net increase in bacterial numbers. Some are still replicating, some are dying. But for everyone that replicates, somebody's got to die. If a bacterial cell has an inclusion at this time, it's going to start to use up those stored nutrients. Because the population is using up everything. There's intense competition. There's only enough resources for this many to go around. And then, eventually, they're going to use up those resources, and they run out of resources, and then you get the exponential decline, or the logarithmic death. They're going to start dying off at the same rate where they replicated. So it's the exact mirror image of the log phase, is the decline phase, or the death phase. You have accumulation of waste, depletion of nutrients and space and oxygen if they needed oxygen. Oh yeah, that question is in here. That's when you're going to use your penicillin or your bacitracin, interfere with peptidoglycan synthesis in the lag phase. That's the most important time to give the penicillin or the bacitracin. Okay, when we did our mycobacterium AFB slides for mycobacterium, we had a little positive control. That was the mycobacterium positive control. Once we stained it, it should come out pink. That's what mycobacterium looks like after an acid-fast stain. The negative control was E. coli. They use E. coli because the cells are about the same size and shape as mycobacterium. They're little tiny bacilli. But E. coli does not have the waxes in the wall, so it comes out green. And that shows you that your slide came out right, your stain works properly if your positive control comes out pink and your negative control comes out green. And then you would compare that to what you see in your oval area. In your oval area, we put our mouth scrapings or our teeth scrapings. But what would be there if it was a real clinical situation? What would you put in that little oval? Sputum, the patient's sputum. So if it's a patient, maybe you just suspect them, maybe you don't even suspect them of tuberculosis. You're just testing to see if he's in an active stage of tuberculosis. If his sputum contains infectious acid-fast bacilli, or infectious tubercle bacilli. Some people call it tubercle bacilli, some people call it acid-fast bacilli. You'll see both terms on your test. And maybe your lab quiz, you might already seen it on your lab quiz. Okay, so where does sputum come from? Does it come from your mouth? No. It comes from where? The lungs. Tuberculosis and leprosy is a lower respiratory tract infection. Upper respiratory tract infection is like neck up. Lower respiratory tract infection is in the lungs, down below. So sputum's got to come up from the lungs. You don't want a spittle sample. You want that gross stuff from the lungs. Okay, talked about biofilms, we talked about blood agar. All right, blood agar's enrichment agar, why? It's enriched with blood. What kind of organisms want to grow on blood? What kind of organisms need blood?
Hemophilic.
Probably pathogenic organisms, particularly organisms that need the blood cells, the hemolytic ones, right? So, if I have alpha hemolytic bacteria, they'll partially digest the blood cells and I'll get a greenish color around the colony. If the bacteria are beta hemolytic, they're going to totally hemolysize the blood cells, break them down, and I'm going to get a clear area around the colonies. If they're enterococcus, they're gamma hemolytic, which means they're not hemolytic. They don't digest the red blood cells, so it's going to remain red. So now what kind of agar am I talking about with the color changes? What kind of agar gives us a color change? What kind of stains give us a color change? Differential. Right. So blood agar is enriched with blood. It's enrichment agar. But it can also be a differential agar because it'll differentiate alpha hemolytic from beta hemolytic from gamma hemolytic. Okay, do you remember your streptococcus groups? Check me, because every once in a while I say one thing and I mean something else. So when you go home, check me. Okay. Group A strep and group B strep. Then we have an API strep, which goes late. Okay, GAS, gas, group A streptococcus. Group B strep, GBS. They're both beta hemolytic. Gas and GBS are both beta hemolytic. What's that mean? Totally digest red blood cells. Not good. Pathogenic. The worst kind of pathogenic. Digests your red blood cells. GAS and GBS. GAS is what bacterium? Streptococcus who? Better look that up. GBS is another kind of streptococcus. What kind? Better look that up. Okay. What are your alpha hemolytic streptococcus? Those are Streptococcus viridans group, which is your oral Streptococcus mutans, Streptococcus sanguis. They're alpha hemolytic. Bad, but not the worst. Could cause tooth abscesses, stuff like that. Also, Streptococcus pneumoniae. Remember the pneumococcus? In fact, I just saw on the news today, they were talking about kids going back to school. They got to get their vaccinations for the meningococcal meningitis. What kind of bacteria causes meningococcal meningitis? What kind of bacteria causes gonococcal urethritis? Oh boy, you guys are really brain dead. Okay, whoa. Neisseria gonorrhea. Neisseria is a gram-negative diplococcus with fimbria. So Neisseria gonorrhea is called the gonococcus. So if you have urethritis, your wee-wee hurts, itis, inflammation, urethritis of the ureter, of your, when you urinate, urethritis, your urethra's inflamed. What causes the inflammation of your urethra? If it's the gonococcus, that means it's gonorrhea that's making your urethra inflamed. What if it's non-gonococcal urethritis? Now what's causing it? Could be chlamydia. Could be an ordinary urinary tract infection caused by E. coli or Enterococcus fetalis, or maybe even Staphylococcus saprophyticus. Right? So if it's gonococcal, that means, hello, Neisseria gonorrhea. You've been bad. If it's non-gonococcal, still might mean you were bad. It's chlamydia, which is also an STD. Or it might mean you just wiped some poop up there. Or it might mean maybe you had a little too much sex and some bacteria from the perineal area got shoved up your urethra. That's called honeymoon cystitis. Anybody ever hear that expression? I don't know why nobody ever hears that expression nowadays. That was a big expression in the olden days. Honeymoon cystitis. Your bladder is the cyst. Itis, inflamed. So your bladder's inflamed. Why? Because you have a urinary tract infection, a UTI. How'd you get a UTI? Different ways to get a UTI. One way is you have sex and you got gonorrhea. Another way is you have sex and you got chlamydia. Another way is you have sex and you got both. So STDs can cause urethritis and bladder infections too, but more often, UTI even at home is because some of the fecal bacteria from down there traveled up the urethra. And one of the things that can help that happen is wiping in the wrong direction, or if you had a bout of diarrhea and the stuff got everywhere, it was a big mess. Another thing could also be oral sex, because when all that's going on, some bacteria goes from where it came from up to where it shouldn't ought to be. And that's called honeymoon cystitis. Also, the physical action of intercourse, the pushing and the rubbing, can cause some of the bacteria from the perineal area to get shoved up a woman's urethra. Because a woman's urethra is very short, it's easy for bacteria to get up there. Boys can get urinary tract infections also, sometimes from not wearing underwear. Going commando all the time, that's probably the most recent, the most common cause for males to get urinary tract infections. But what happens is bacteria that shouldn't be up there get pushed up there. So anyway, they called it honeymoon cystitis because you're having a lot of sex. Whatever kind of sex it is, whether it's oral or anal or vaginal or whatever, there's a lot of sex going on and the bacteria could get pushed up the urethra. And so usually in the olden days, your honeymoon was the first time you had sex, and probably your boyfriend's been waiting so long, you're gonna have a lot of sex. So that was called honeymoon cystitis. Okay, so if you have gonococcal urethritis, caused by what? Neisseria gonorrhea. You have an STD. If it's non-gonococcal, it's caused by something